Good morning. Good morning. Hi, guys. Thanks for being here. My name's Liz Kalina, and I work at Ipsen. And one of the things that we do at our company is we try to be as relevant as possible to the people and communities that we engage with. And so for us, that means a lot less talking and a lot more listening. And what we really care about is real-life experience. We launched a program called Voices, and it's meant to power community experts through shared experience. And today is our very first Voices Community Summit, so thank you for being here. You're going to meet 13 amazing people with 13 very unique rare liver disease perspectives, living with, caring for, advocating on behalf of, probably a combination of all of those things. In addition to the healthcare experts and the patient experts that we have here in the room, I also want to extend a warm welcome, we'll say hi to you, on the live stream. There are folks who are dialed in from YouTube and Facebook who are joining us today, so we're pleased that you're here. The information that you're going to receive today is not always easy to share. So on behalf of Ipsen, I do want to recognize the privilege that it is to receive someone's story and extend our gratitude to all of the folks who are here today and also being so brave to share their story. One person's experience is just that. It's their own experience. This is not a forum for medical advice. If you have questions, talk to your doctor. With that, I'm so excited to start our first panel. It's called Being CEO of Your Own Health, because we believe everybody has a boss role to play when it comes to self-advocacy or advocating for others through diagnosis, treatment, finding the right care, all around, whole person care. So moderated by Lorraine, who's CEO of the American Liver Foundation, joined by Elle Marie, who's living with PBC and is a PBC advocate, and Marcus, most importantly, dad to Bryson and London, all living with Alagille Syndrome. I can't think of three better people to help us flex our expert muscle and become CEOs of our own health. Thank you.
Ooh, comfy chairs. Hi, we're delighted to be a part of this panel and thank Ipsen for putting together this program. As you heard, I'm Lorraine Steele. I'm the CEO of the American Liver Foundation. So I guess it was appropriate to talk about CEO of your own health. But let me tell you, I think more so, I'm an advocate. I've actually been married to a man who's had type 1 diabetes and autoimmune disease for 40 years. So, it's really a pleasure because I sure understand the role of caregiver. And we're so excited that we have Elle Marie and Marcus, and you're going to be hearing about their stories, but we have a lot of great questions to get to, and so we're going to jump right in. So take us to the beginning. How did you or your family members advocate for your needs with your doctor? How did you know something was wrong? And we'll start with you, Elle Marie.
Awesome. Thank you, Lorraine, and I appreciate your advocacy on behalf of all liver patients. So for me, it started back in January of 2019. My get up and go just wasn't there. I was very tired, extremely tired, could barely get out of bed. And so I started with my primary care physician, very tired, explaining to him, didn't know what was going on, and his original thoughts were, perhaps it's your weight, change your diet, exercise more, as most doctors would say. But by March, I knew something was wrong and it was getting progressively worse. And I really just demanded answers. I knew that it was something different, and I asked what were next steps. Originally, he just kind of thought we should just monitor, but because it was starting to affect my activities of daily living, I literally couldn't get out of bed. The alkaline phosphates became elevated, so I knew the labs were showing there was something going on, and so finally I said, what are next steps? And eventually we got some answers.
That's good to know. And Marcus, we were anxious to hear your story when diagnosed with Alagille syndrome.
Yes. Thank you for having me. For me, it started in 2015 when our middle son was born. I had a lot of health issues, and I was diagnosed with different things. But when our middle son was born, when he was, after 6 weeks, he was very jaundiced. So my wife and I were really concerned about that. And I always ask a lot of questions because from my health concerns, I deal with my doctors regularly. So with him, we made an appointment, took him to the doctor, we questioned the jaundice. So they did a lot of blood work, and come to find out he had Alagille Syndrome. Didn't know where it came from, and that's when we started doing genetic testing and found out that it started with me. So more questions came because with the diagnosis that I had previously, it was a concern, well, did I have Alagilles all along? Or was I misdiagnosed? So just went through the long process from there of genetic testing, and yeah.
So important, genetic testing, absolutely. And I'm sure that will be a common theme as this program moves forward. Another question, rare liver disease diagnosis can be a challenge in itself. Walk us through the path to receive your diagnosis. What was the process to get there?
It wasn't easy. Again, my primary care physician really wasn't taking my concerns seriously, and so I had to take matters into my own hands. Originally, he thought perhaps the elevated lab showed that perhaps it was either bone or, he actually said, it's either your bone or your liver, and I said, well, I need both, so what are I need both, so where do we start? Where do we go next? And so because I didn't feel like he was listening, I found it important to do my own research. And I was able to take matters into my own hands. I reached out to, I thought bone seemed a little far-fetched, but I figured I'd start with liver. I reached out did some research and found a facility in my area that had one of the top liver specialists, and so I reached out to them, and thankfully I have a PPO. I was able to call on Friday, and I had an appointment by Monday. By Wednesday, I had a diagnosis.
That was pretty quick, actually. I'm sure that's not the case for many, many patients. So probably pretty lucky that you're in Chicago, right?
Yes.
And have great medical care. Real challenge when you're in maybe a rural community, and probably takes a lot longer. What about with your diagnosis, Marcus?
Fortunately for us, so we had great doctors. So it wasn't a lot of going back and forth. So like I said, my son was jaundiced, so they did the blood work. We had diagnosis within a couple of weeks for him, and so of course we had to do genetic testing. So they tested my wife and I and both of my parents, and come to find out that it started with me. So that's when I was diagnosed with Alagilles. It started with me. My parents didn't have it, my wife didn't have it. So the difficult part was being that I've already had a lot of health issues. With my first son, my wife went through a lot of testing just to make sure he didn't have all of the issues that I had. So the difficult part for me was knowing that I had it and I give it to my son. So that was a struggle for me because now it's like my son is going to have to live through these issues and go through, liver transplants and hopefully not kidney or heart because I have those issues as well. But that was the most difficult part, just knowing that my children or my child is going to have to live through that. And then if we had more children in the future, it was a 50-50 chance that they would have Alagilles as well, which in turn we had a third son, and he has Alagilles, and he had a liver transplant as well. So that was the most difficult part.
So you have 3 boys.
I have 3 boys,
and
yes.
2.
And 2 of them have Alagilles.
Oh, my
yes,
gosh.
The middle and the youngest. My middle son had liver transplant at 7 months, and my 2-year-old had a liver transplant at 1 year old.
Oh, my gosh.
So, that's a difficult part with me mentally. Just, it's like, okay, why do they have to go through this because of me, So my prayer now is to, hopefully they don't have to go through the other things that I had to go through. Yeah, so that's the struggle, but,
Yeah, it's got to be tough.
It is, yeah.
And you have an amazing wife that I've had an opportunity to meet.
Yes,
and
she's the backbone. She's
sure,
the rock.
Yeah, so together you can be that support system for your children. And actually the son without Alagille, that must be a tough situation for him.
It is, and he's a worry warrior, but he's great. He adores his little brothers. He does everything for them, so he's wonderful. He's a huge support as well.
Yeah.
So, yeah.
So, Elle-Marie, after receiving the diagnosis of PBC, what were the questions? So, we already figured out that you got diagnosed fairly quickly, but what were the questions that you had, and did your HCP have all the answers, or were you already working with specialists?
So thank you. That's a really good question. I had a lot of questions. Actually, I received the diagnosis about 3 a.m. in the MyChart, so the electronics medical record. So that's probably not the best place to get your diagnosis because, of course, and I do never recommend this. I went to Dr. Google initially, and that was very frightening because it's 3 a.m. Who am I going to talk to about this new diagnosis that I received? So the questions were, from what I saw on Google, how much of that is true? And so, of course, what should I expect my quality of life to be? Will I need a liver transplant? So many questions about how did I end up with this condition? What is PBC? Even though I worked in healthcare, never heard of PBC. And so the fear of what my new normal will look like and if the fatigue will ever go away, those are some of the concerns that I had. My hepatologist was knowledgeable about PBC. He has other PBC patients, and he did further tests to see where I was as far as the progression of the condition. But really, he just kind of encouraged me to go online and connect with the community, with the online like Facebook groups, and I did that. But certainly, nothing was more helpful than connecting with another individual with PBC in person. And that was life-changing for me.
That peer support, isn't it so, so important?
Absolutely. It's really life-changing. Every morning I woke up thinking about PBC until I met others with PBC and learned that I would be living with the condition and I wouldn't be dying of it. So it did change my life.
Yeah, a real message there, that peer support. So.
Yes.
So, Marcus, how do you balance taking control of your health with your other responsibilities? You're a husband, you're a father, you're a caregiver to your children, right, who share that same condition.
A lot of support. Like I said, my wife she's the rock, she's the backbone. She does so much, Of course, my parents, our grandparents. My oldest son, just a lot of support, rest, I have to listen to my body because, I suffer with it as well. So when my body says rest, I rest, and that's when I depend on my wife and the rest of the support system. My oldest son plays travel baseball, so, and then, of course, they're in school. So, like, if my wife takes them to school, I pick them up. So what I try to do is rest and just preserve myself through the day if I know I have a lot to do in the afternoon. So she allows me to preserve myself during the day so I can do what I need to do in the afternoon. Support's the biggest thing. That's the best way I can say that I balance that. Is just resting, support, and just doing what I can do. A lot of times I get tired, and I'm used to pushing, so I just keep pushing. Mm-hmm. But I have to listen to my body. So when I don't listen to my body, it puts me down for a couple of days. So that's the biggest thing, listening to my body. But I also try to make sure my wife gets rest as well. Both of us can't be down. So that's the biggest thing. Yeah, just rest.
That's good, and got to take good care of yourself. It's
Absolutely.
Like being on the airplane, right? When they say the oxygen drops down, you have to take oxygen first before you give the oxygen to those sitting next to you who may need help. And you're that way with being a father, and you have these 2 children, right, with Alagille as well. So very important, wise advice.
Yeah. And I have to hide it sometimes. Like I said, my oldest is a worry warrior, so my kids check on me all the time. Dad, you okay? Dad, you okay? Oh. So, but, I don't let them know all the time. It's just, like I said, just have to keep pushing.
Yep.
So,
Okay, our last question. What advice would you give to someone about how to be the CEO of their own health? Ella Marie.
Yeah, so first of all, know your body. It's your body. You know it better than anyone else, even your doctors. And so I would say listen to your body. It tells you when something's not right. And when we ignore it, things go wrong, right? And so I definitely would encourage everyone to make sure that they're listening, they're taking ownership of what's happening with themselves. But then also speaking up for yourself. So if you feel like the doctors or clinicians, whoever you're working with, are ignoring you, you've got to speak up. And if you don't get the answers you need, you've got to find someone else that's willing to get you the answers that you need. Lastly, seek support. And if it's not local, find it internationally, wherever you got to find the support. There's a great community for every single condition out there, and I'm learning that. I've learned that in my PBC journey, and I'm continuing to build upon that based on what I've experienced and what I hope others with PBC don't have to experience moving forward. So that's what I would encourage.
Good advice from a CEO, huh?
Someday.
My sentiments are the same. Listen to your body first of all, because like I said, if you're not healthy, you can't help anyone else, especially with having 3 boys and a wife, and also still being the provider. Be fearless. Be fearless in asking questions, advocating for yourself, for your children. A lot of times when you're sick and people know that you're sick, they try to take advantage of you. But be fearless, don't take no for an answer. Every doctor that we deal with, they know, my wife and I, we don't sugarcoat anything, and we don't want them to sugarcoat anything. Let us know what we're dealing with head on, so we'll know how to handle it, Don't beat around the bush with this, I don't want hypothetical. I want what it is, and that's how we ask our questions. That's how we give our answers. Like I said, we have a huge support team, so we want to let our support team know what they're dealing with as well. Because a lot of people are willing to help, but sometimes they don't know the juice of it, and they don't know how to help. So we tell them exactly what it is, so they know what they're dealing with. So either you're going to help or you're not, because if you're not going to help, we have to go another avenue. Because ultimately we have kids to think about. Because you're going to put your kids first. So definitely letting your support team know. But just that's my biggest thing, just being fearless and asking questions, advocating for yourself and your children. Because like she said, we have to live with this condition and die with it. And while I'm here, I'm going to make the best of it, and I don't want anything getting in my way from living my life and enjoying my life while I'm here. So,
well, you sound like a pretty effective CEO of your own life too. So
yeah, I'm very straightforward. So
yeah, pretty impressive. Well, thank you both, Ella Marie and Marcus, for sharing your inspirational stories, your perspectives, and the need to be your own CEO of your health. So we really are so inspired by you both, and wish you both the best on your liver journey.
Thank you so much.
With PBC and Alagille Syndrome. So
Thank you, Lorraine.
thank you.
Thank you.
Thank you.
Thank you, Lorraine, Ella Marie, and Marcus. So they set the intention, right? What it means to be CEO of your own health, know your body, be fearless. Those are really powerful, powerful things. But we've got an intention. The next thing we need to do is put it into practice, and that can be a little bit harder, right? So we're going to speak with Mahesh, who is resident of internal medicine, also living with PSC and a board member of PSC Partners. We're going to hear from Sybil, living with PBC, and we're also going to hear from Emily, who is a pediatric nurse. Most importantly, she's mom to Cedar. Cedar's living with PFIC. Emily also co-founded and is the executive director of the PFIC network. So what they're going to do is they're going to talk to us about how lifestyle, preference, values all of those things tied to qualified medical expertise, how those can have a positive benefit. So welcome our next panel. Thanks.
Thank you so much for the kind introduction. So that was a great panel, I think, that we had right before us. I think kind of building on that, our discussion is going to be more about how to be a shared decision maker with your healthcare provider. But I think for us, since we're a new group, it's important to start kind of where we began. So could both of you tell me a little bit about how you felt like information was shared at your diagnosis and how you wish information was kind of relayed initially?
Thanks for the question. So my daughter was diagnosed 13 years ago. So it was a very different time for what information was available. At the time, we were at the doctor's office. She was told of her diagnosis. She has progressive familial intrahepatic cholestasis. What questions do you have? And I kind of didn't know what to say. I had a lot of questions. But at the time, there weren't really any answers for our questions. So we were told she will likely have a liver transplant at an unknown point in time. There's potential treatments, but we don't know what would work. She'll probably itch quite a bit, but we don't know how severely that's going to impact her. And so we weren't really given much information. We were given a lot of, this might be her life. And when we left, we weren't given any materials. We looked on the internet, but we also didn't find, much information. Everything that we found was very devastating. We saw a lot of the devastating cases. When we went back to the doctor, we just kept on, I think we were just in survival mode, but we weren't given any information directly to us. And as a nurse, I just kept on going down those rabbit holes of there's got to be something, and I wasn't really finding anything of use.
I just want to say thank you for the opportunity to be here today. I was actually misdiagnosed almost 12 years ago with a different liver disease. At that time, I did question my diagnosis and actually reviewed my biopsy report and kind of came to the conclusion that it was a bit inconclusive in saying that, this is what it looks like. So my, gastroenterologist, that was what was diagnosed, and it wasn't until, 12 years later that I found out that was an incorrect diagnosis. But in looking back, like I think Emily said, I think there was probably less awareness for, this rare liver disease, PVC, that I have. So I think that, in just looking at that whole situation, I kind of, to put it into perspective, I think that, awareness is just so important. And I think that, we're doing a much better job of that today. From what I've seen and heard, I think that the word is getting out there, and it's important, obviously, because to intervene with treatment if there are treatments available. Certainly there were 12 years that passed. Maybe it would have changed outcomes, maybe not. But I think anytime we can begin treatment if there is treatment available, and also slow the progression of the disease. But that's kind of where the beginning of my story.
Yeah, thank you both for sharing those perspectives. I think that's very helpful. I think for me, I was actually diagnosed as a kid when I was 14 with PSC. And I think kind of going into that, you don't get as much information from the doctor, like you were saying, Emily. So then you go on the internet and you go on these rabbit holes that can end up not being productive, especially since the information that's out there can be unreliable. And I think kind of building off that, where did you go for your information? Where did you try and learn more about you or your loved one's disease? Did you find any groups or resources especially helpful?
So at first, I couldn't find anything. It was my daughter was 3 years old when I wandered upon a community that was on Facebook. I had no idea at the start to look on Facebook for a community experiencing PFIC. But the day that I found the community, our world changed. I scrolled through every single message. The group had been created, it was 5 years before, just by a patient who experienced intermittent episodic PFIC. And it was just for her family, and then it kind of grew slowly. So it had been in existence at a very small scale. But what I found was a community of people who were asking the same questions, who were having the same experiences. They also didn't have any answers, but they were starting to talk through things that were helping them, or things that weren't, or questions they asked their doctors, or have you looked into this? And it was life-changing, just having a community of people that experienced this, that was in the same boat. And all of a sudden, where I didn't have any more information as to how her diagnosis was going to impact her trajectory, or anything that I would learn with her doctor over time. What I did have is an understanding of how she can live with this disease, and I was getting that from this community of people. So that was actually a few years later, in creating the network with my co-founder Tara, who you'll hear from later. That was the reason that we created the network, was so that we could bridge that gap, so that nobody would have to experience diagnosis alone.
I have basically looked, I would say, everywhere. It's just, my nature is just to be curious, ask questions. But I initially started out, I think, like Emily said, going to Facebook and finding out about the different organizations. And I was fortunate in that I've actually been able to attend 2 of the PBC conferences. And my first one was with the PBCers, which is the foundation, or the group that's in the US. And I also recently was able to attend a conference in Edinburgh with the UK Foundation. But my experience was, in being able to go to this conference, was to meet fellow patients that have PBC. And that is so, I think, important, to be able to connect with others that may be having similar symptoms, and that can relate to the things that you're talking about. Also valuable is the information that these groups provide. They provide written literature that you can actually take to your doctor, because many of my doctors have no idea what PBC is. Even my gastro has maybe 1 or 2 other patients. So that's valuable. Listening to the experts, I've learned that you really need to, find out, get your information from the experts, and that's been valuable at these conferences. And actually, every week they do podcasts. Doctors, volunteer their time, they come on and they answer questions, patient questions, which is so valuable, because if you have something going on and you're, wondering about it, you can actually ask a question and get answers to that. So that's really valuable. I've read books, medical journals and such, and so on. And I think that, again, in dealing with something that maybe your doctors are not familiar with, it really helps when you have something black and white. I tend to take, articles if it's something that I'm seeing with maybe my blood work or whatever that, maybe looks like something else, but I think it's PBC related. I can say, well, here's the information, here's an article. And generally, the providers are willing to, hopefully learn more and say, let me look at that and take a look at it, and, so that they're more informed.
Yeah, thank you both for sharing that. I think for me, I was a kid looking on the internet, and I just remember seeing life expectancy until liver transplant 10 years, which was pretty impactful for me personally. But I think when I found PSC Partners, actually headed by Ricky, who's here today, it was a website and a community that I found was very helpful in terms of navigating the healthcare system, as well as connecting others similar to both of you at the conference. And I think advocacy groups are very important in terms of trying to find your information, trying to advocate for yourself, and talk to others who also have a similar disease process, who are undergoing very similar circumstances. Kind of going back to your relationship with your healthcare provider, can you name one thing that your healthcare provider did well and when you were first diagnosed or throughout your healthcare journey? And then one thing you wish they could improve on?
I was very fortunate. I had a great relationship with my healthcare provider, or with, I guess I should say, my daughter's provider, her specialist. I didn't feel that way at first. I think I was just in survival mode, and I thought somebody else, he only had 2 patients with PFIC. There's got to be somebody who has more experience. And I think I was a very challenging parent at that time in the first year. And it's actually funny because he is one of, he actually made a profound impact in the field that I learned later on. But I was always challenging, there's got to be somebody who's had more experience with PFIC. He was very patient with that, and he listened. As a nurse, I ask a ton of questions. That's just my nature. So I will, whether it's, for better or for worse, I will be a partner in my daughter's care. That's just, that's my training. And so he was very patient with that, listened to my questions. Wasn't always able to, take my perspective or accommodate, but he was very good at, just kind of sharing back the why, which I really, really appreciated. I can't think of what I would want him to do better, or his care team. I think I can reflect. I wouldn't have picked up on this at the time, but I can reflect and just say that maybe they're able to provide me as a parent more resources and acknowledge the burden that I carry as a parent, mental health, emotional burden, and maybe be able to just, direct me or provide me with resources so that I could cope and be a better parent. I mean, Lorraine mentioned, putting your oxygen mask on, that's what we do. We survive as parents, but we also will need resources to do so because it is very hard to do that every day.
I think that one thing that my physician or physicians have done well, and that I've, stuck with, I guess you could say, or that continued to get care from, is listening. I think that that's a key thing, to listen to their patients and where, and find out where we're coming from. Not everyone comes from the same place. Not everyone wants to, maybe be as informed, or others want, they want to know everything. And I think just listening is so important. And actually, in answering questions, generally I prepare for my appointments. I usually have a long list of lots of questions. And, it's okay if they, may not know the answer, but if they're willing to say, I'll get back to you, or I'll check on this, I think that is just, so important to, again, just address the needs of, and that's something that I, look for in a physician. As far as, what, maybe they haven't done well, I guess I can, obviously my misdiagnosis, I wish, that had been different. And I can think of an instance where when I was seeking out new doctors after being diagnosed, I wanted to know what stage that my disease was at. I mean, I think that's a natural question, to want to know where am I at in this whole picture. And I consulted with a new doctor regarding my liver, and she said, well, I'd have to see your, your biopsy or pathology report. And so I said, well, give me a minute. I have it here. I'll bring it up on my phone. And when she looked at it, she said, well, it doesn't matter because treatment is the same. Well, that's true, treatment is the same, but it did matter to me. And while I felt she was knowledgeable, I think that was kind of insensitive to not understand that a patient's going to want to know where they're at with their disease progression. So that kind of told me that this really was someone that I wasn't going to be able to probably work with. Even though she may have been knowledgeable about my disease, I think that there needs to be more sensitivity, certainly, to a patient's concerns.
Yeah, 100%. I think one strategy that you mentioned that I only learned later on in my journey was creating an agenda before you go into a doctor's appointment. Because sometimes I think when you go into a doctor's appointment, it may be more unorganized and may not address the needs that you actually want to talk about with your doctor. So coming down with a list of questions before your appointment, I think, is a very good strategy, as you mentioned, to help prepare you. Just basically doing your homework before.
Absolutely.
Yeah. Emily, one thing you kind of mentioned was your overall health and wellness. Were there any discussions for both of you about your overall health and wellness beyond the treatment plan? And what about your goals for the future?
That's a great question, a heavy question. The only time I can recall, a question into my overall health it was probably, I don't remember the instance, but there was an appointment where I must not have reacted very well. I think there's a lot of uncertainty in PFIC. So, you make a choice for my daughter, it was, we chose to do a surgical intervention, but we didn't know if it was going to work. And so that type of uncertainty is very hard to navigate. So I imagine that I was not very easy to deal with at that time. I appreciated this less at the time and more so after the fact. But, my daughter's nurse reached out to me and said, she will be fine, but I see that you are not fine. And I think at the time I was angry with her. I just wanted her to say, focus on her. I'm going to deal with this. But, when I got out of that survival mode, I was grateful that she at least acknowledged that and cared. Again, it was still hard to navigate, but she acknowledged the challenge. As far as goals for the future, I learned along the way that I don't get to have goals for the future. I do, but the longest period of stability in our life was 1 year. And it was enough for me to feel like, okay, we're on track. Maybe we're not going to end up in the hospital for, our birthdays this year. And then the ball would drop. And so, that's happened enough times to where, I have goals for the future, but I also realize that life could change in an instant. And so I have to just learn how to be okay with, the expectations that we're going to live day by day, and that's okay. And we'll, incrementally reach these goals. But we just kind of have to let go a little bit of the long-term future because we have to be available to navigate the now.
I think that as far as like health and wellness, sometimes we're more focused on disease. And I think, our healthcare system in general is maybe getting to the point where we're a little bit more looking at our overall wellness and health. That is the question, right? I got the right. Okay. But I think as I get older, I'm seeing more specialists, and they're looking at this part or that part, and I think sometimes we forget the whole picture. We're a whole person. And, even though it might be heart, lungs, kidney, whatever, everything is connected. So I think that we need kind of a more, I don't know if you call it holistic, but looking at the whole body and putting the pieces together. And I find that to be frustrating, a little bit frustrating. So for for myself, I feel that, I'm my best, person to manage things, to make my own decisions, like Marie said. We are, responsible for our own health, and we know our own bodies best. So I've really, as far as goals for the future, I try to, manage my lifestyle as best I can, have as much, a healthy diet, exercise, try to reduce stress by doing things that I enjoy because, the mental health is so connected to our physical health. So I just think that, I've kind of pretty much taken charge and just, try to do the things that are, hopefully beneficial to my physical health.
Great. I think one aspect that you mentioned, Emily, that I think is underaddressed in healthcare is caregiver burden. A lot of the time the focus is on the patients, what they're experiencing, but I do think that, you know, the healthcare system in general needs to pay more attention to healthcare caregivers as well, because they have to undergo a lot in terms of taking care of their loved ones. Did you feel like you were a partner in you and your loved ones' healthcare decisions, or did you feel like you were being told to do something? Is there a certain preference in terms of how you would prefer your relationship with your doctor?
100% a partner. My preference is 100% a partner, and I do feel like I was a partner. Even though, you know, we didn't have a clear path, I did feel heard, and that was important. I did feel like my preferences were taken into consideration, and again, if something couldn't happen in the way that I was hoping, I was told, you know, it was shared with me as to why. So I felt like a partner, and I think that was one of the most important things that got us through our journey.
I've always felt that, you know, my healthcare needs to, you know, I need to be a partner with my provider. I've always felt that way. And I've always chosen my providers so that, you know, they understand that and that we work together as a team. I think, however, things have changed slightly since I've been diagnosed with PBC. I feel like I'm pretty much steering the ship, so to speak, I guess you could call it, where I have had to, and you know, inform myself, become empowered. I've, you know, searched out information so that I'm knowledgeable, and I feel that it's kind of, things have changed a little bit in that balance, because now I'm sharing maybe information with my doctors that they may not know about, because most of my doctors probably aren't aware of PBC or understand the symptoms. So I feel like I'm steering the ship a little bit more, which, you know, is okay, you know, but I think that, you know, it's a little bit more difficult. But, you know, by my nature, I want to know things. I want to make sure things are done right. I want to know the details. So I feel that, you know, pretty much that I've had to, I guess, you know, empower my doctors, or, you know, give them the knowledge. Or sometimes if I'm having a symptom and they think it's something else, I say, well, no, I think it might be PBC, and here's the information that I have. And, you know, hopefully they're receptive to that and willing to, you know, understand that, so that we can be more of a, you know, shared decision, you know, sharing our decisions.
Yeah, thank you both for sharing that. I think for me, I actually evolved from someone who preferred to get what I was told what to do as a kid, to where I became more of a shared partner in decision making. And I think part of that is because I was diagnosed as a kid, and, you know, you don't want to really think about those things as a kid. But I don't think there's a right answer in terms of, at least personally, I don't think there's a right answer in terms of how one person has to go about it. I think it's 100% personal preference. I think our final question, because of time, is what's one thing you wish you could tell your old self at diagnosis?
Just one thing.
Just one thing.
That you will learn to navigate the process, help others along the way, and your daughter will also do the same. Quick connection to what you just mentioned. I'm now raising a teenager who I am seeing that shift in terms of somebody that's been told what to do and now taking autonomy for her health, and I'm very proud.
Thank you for sharing that.
I think that, you know, I would tell myself, you know, don't go down the Google rabbit hole, as I call it, because there's so much information out there. So much of it is bad information. There is good information. You know, go to the experts, get good information, you know, and, you know, because there is so much information, we're often able, as someone else mentioned, to get our results before our physicians are. You know, it's only it's natural to want to find out, oh, what does this mean? Oh, no, this is, you know, blood work, you know, something's, you know, increased or whatever. But just understand that, you know, it may not be the whole picture, and that we need to get our information from the best sources.
I think for me, I would probably tell my old self not to focus too much on the disease and try and enjoy life as well. I think the disease is just one part of you, and it's an important aspect of you, but it shouldn't define how you think about life, it will affect it for sure, but you shouldn't be worrying about it 100% of the time.
Yeah, great advice.
Great, yeah, thank you both for your time.
Thank you.
All right, so we're going to continue our exploration into being CEOs of our own health a little bit further. But I wanted to say, I think a t-shirt should be made that says "Navigate the Now." I thought that was really powerful when you said that. So one thing about caring for your whole self is really getting comfortable with being uncomfortable. We know that rare liver disease disrupts sleep. And when you don't sleep, it's harder. Life is harder. There can be impacts on mental health. You also could potentially have issues with relationships, partnerships, intimacy, all of those types of things. So we'll be joined by Roberta, who's going to moderate our next panel. Roberta is mom to Chloe and Claudia and also president of the Alagille Syndrome Alliance. And she's going to be joined by Jackie living with PBC and Josh living with PFIC. So we look forward to hearing from you. Thank you.
Thank you both for being here. It's been so amazing getting to learn about their stories. I'm really excited to talk about living with or kind of navigating a diagnostic odyssey. And I want to check in with you first with your fairly new diagnoses. How are you feeling today? And how has it been navigating the emotional side of finding a diagnosis?
Good morning. Thank you for having me. It's been emotionally, I'm okay now. If you would ask me a couple of years, initially when I got diagnosed with this issue, it was very overwhelming, as I was already dealing with symptoms prior to the diagnosis. Severe fatigue, muscle pain, aches, joints, not understanding what was going on at the time. Elevated liver enzyme numbers. So finally, after seeing various specialists, PCP, gastrology, rheumatology, I come to finally get a diagnosis. And obviously, as someone mentioned earlier, you go to the portal because now your results hit. And all of a sudden, I'm sitting in my house by myself, and I see this primary biliary cholangitis, and I'm like, oh, that's what I have. What is this? So, of course, the Google rabbit hole, as Sybil mentioned, I went in Google, started researching, and yes, a lot of information came up, good, bad, and ugly. So I was like, oh, my God. So that completely just threw me off. Emailed my doctor, had questions. But definitely the emotional side of things was very difficult for me because I'm thinking to myself, well, now how I'm going to live with this new normal? How is my family going to adjust to this, as I am, I'm a military spouse. So my husband is, when he has to go on duty, he has to go on duty, and I got to hold the front at home. So all these things came to mind, and then other situations started compounding that made it emotionally difficult to navigate the disease and everything else, where my mental health was severely affected. Anxiety and depression, unfortunately, hit pretty hard for me. And I had to eventually seek the help of a therapist to help me navigate these things, to help me sort out the emotions and the feelings that I was dealing with at the time of, am I enough, not being able to do the things that I used to do. I have kids at home. How are my kids gonna, all these things were very difficult to navigate at that time. I wasn't giving myself enough grace at that point because I wanted to be the person that I was before. And I didn't realize that I had to learn that I had to grieve who I was before and move on with the new situation that now I was dealing with and that I now had to accept.
It's interesting because Marcus had talked about how to navigate family life at home, and you're thinking, you know, with your new diagnosis about your family and how to, you know, maneuver this diagnosis. So I love what you're saying about, you know, taking control of your own mental health and having to prioritize that through this diagnosis.
Yeah, correct.
Josh?
Good morning. Thanks for having me. Today, I'm doing okay. I think now that I have a little bit more control over the condition and a lot of the symptoms are not really bothering me as much, mental health-wise, I've been okay. I try not to think about it, you know, anymore. But for probably 2 years, 3 years before I was able to get my symptoms under control, it was a mess. I wasn't sleeping, which, you know, created a lot of other issues. Stuff at home with the family, it definitely, you know, things were rough. Still are a little bit rough from that. But, you know, I've learned to cope and figure out systems that make sense for me and kind of my best way to move forward. And I guess just not thinking about it as much has helped. Now I just stress out about other things.
Well, and it's interesting, before you get your diagnosis, as part of this diagnostic odyssey, you're experiencing symptoms, you're trying to navigate your friendships, maybe there's some isolation, what's happening with, you know, your friends and family, are they tolerating what you guys are feeling, do you feel, you know, so there's a lot to navigate. And then when you get a diagnosis, how do you share that with your friends and family? How do you share that with your employers and your coworkers?
Yeah, people don't really understand what you're going through.
Yeah.
And for me, it was just like the uncertainty of like, am I going to need a transplant? Am I going to die? I didn't really know what was going on. So it just kind of messed with my head. It was like fixated on that every day.
Yeah, it's scary. It's definitely scary because that's one of the things that I was thinking. Like, okay, so how bad is it? What stage am I on? You know, am I going to get a transplant in the future? Like, how is my quality of life going to look like? I've depended a lot on the support of, at the time, my parents were very supportive because they knew what I was dealing with prior to the diagnosis. And finally, when the diagnosis came in, that they heard about it, they're like, well, you know, now that we know, you know, we pray with you, you know, we support you. My best friend of like 30-something years, she's been like the person that I talk to and rant to when I'm upset, and she listens. She's been there through this journey, has been there before, has been there after. So I'm grateful for that. My husband, my family, my kids, I mean, they've been, again, it was a rough patch with us at home, obviously, but we're getting to a better place. And we are in a better place now, obviously, but again, it takes a lot. I mean, once I got diagnosed, I was laid off from my job, but it was for different reasons.
Right.
And at that point, we decided that it was better for me to be home and just kind of dealt with the situation, dealt with the different things. And now I'm working, but I'm working from home.
Right.
Gives me an opportunity to, you know, go to
And do you share
appointments.
that with your coworkers or tell them what's happening? And Josh, do you share that with the people you work with?
I did share that initially before I stopped working, and even now when I work from home, I mean, they're aware that I do have this rare autoimmune issue. I think it's fair to say that, you know, because this is something that is so rare, I would like for people to have the awareness of what it is that we're dealing with. So they could learn more, because obviously, you know, when I tell them about it, they're like, well, but you don't look sick. It's the first thing that they tell me.
Yeah.
I'm like, well, just because I don't look sick does not mean that I don't feel well. I just don't like to look how I feel.
Invisibility is interesting in that way, isn't it?
Extremely interesting.
Yeah.
Absolutely is.
Yeah. Josh?
I mean, my situation is like, has been very complicated because I barely like understood what was going on.
Right.
So having to explain that to other people, it's just like, I try, but oftentimes, you know, people only want to go surface level with things. So,
Right.
Yeah, I
Well,
do it when I
when you're
can.
new in it, it's all, you don't even know everything about it yet,
Right.
so it's hard to even lay it out on the
Because
table
my
for
doctors
someone.
didn't even really know what was
Right,
going on. So
right.
if my doctors don't know what's going on, how am I going to explain that to someone?
Right.
You know, I can try, but it just is frustrating.
When you had your diagnosis, you know, we've talked several times on different, you know, panels about going down the Google rabbit hole, you know, every armchair doctor at home looking at, you know, what's going on. Did you feel compelled to go into the community groups to find any? Did you want to? We do hear from some adults, even in our Alagille community, that they're not sure they're ready for that, or they don't know what they can get back in return from being in the community. And a lot of times the messaging can be really scary if it's a complicated, you know, syndrome or disease. So did you feel compelled to connect with the communities? Did you want to? And when you did, what did you learn from them?
I sure did. I sure did. I looked in Facebook, the PVC communities that were available. I was referred to a few, and then I started meeting people. I started reading through different stories, and basically in reading and kind of researching, learning a little bit more about personal experiences, and obviously then I started to understand, well, it looks like, okay, this is what it is, but everybody's different, everybody's reacting different, the treatment is, you know, affects people differently. So, you know, the one person's story may not be my story, you know, my story is gonna be different from the other person. So at that point, I'm thinking I was willing to get from the community, you know, as much information as possible. So I joined the PVCers group, a couple of the Facebook pages, support groups, because I didn't know anyone with this rare disease. So I needed to connect and to have a better understanding on how to navigate this journey, because obviously me talking to someone that has a different disease is not the same as me talking to someone that is dealing with the same thing I'm dealing with. They'll be able to relate better to me, you know, versus someone that doesn't have it. And, you know, I could only drive, you know, my family as crazy as I possibly can, but they will never understand where I'm at because they don't deal with what I'm dealing with. So they are supportive, they help. But, you know, in reference to being able to connect with other people, I had to branch out and I had to look. And I'm grateful that I have, because I've met wonderful people. Civil, I met Amber, I've met other ladies that are not here, Wendy, but that I still keep in contact with, that have been a great support for me.
My issue, most of my research was more symptom-based, because I technically still haven't even been diagnosed with PFIC, even though I think I have it. The genetic testing came back inconclusive. So all of my research was basically around having pruritus and having, you know, solving that issue. So it was actually very frustrating because I didn't even know where to go or who to talk to. So yeah, that was a big challenge for me.
You know, the human experience it's like a fingerprint for every person, you know, completely unique. And your family circumstance, even if you're on the same path for your diagnosis, is truly unique to your experience. And when you come into these communities or where you're talking to doctors, what do you feel, you know, coming into this that maybe are unmet needs still, or unmet thoughts about, you know, things that need to be discussed in the communities in your experience? Have you noticed any gaps in understanding or unmet need yet?
For me, I would say the mental health aspect of things is extremely important.
It is.
I did not realize how this diagnosis and this change was going to affect me specifically mental health-wise. It's not something that I really saw coming. So to have to reach out to eventually, you know, have a therapist, get involved, you know, take some medications to help. It was very difficult to accept, but when I finally came to the realization that, yeah, this is what needs to be done in order for me to be in a better place, then yes, you know, it has to be done. Because it's not only for my benefit, but for the benefit of my family as well. I need to be well in order to take care of my family. And it doesn't only mean physically well, but I have to be mentally and emotionally well. And at the point that I was diagnosed emotionally and mentally, I was not well with the diagnosis. I was grieving who I was, the loss of the person that I was.
Absolutely.
At that point, I was in a grieving process. And it took a while for me to get myself out of that stage.
Right.
So it's definitely important that that aspect is discussed with patients, because yes, you see the outside, but you have to remember you're dealing with a human being that is not only the physical, it's also the spiritual, that emotional aspect on, okay, now you gave them this diagnosis, you know, how are they going to react to this? You know, provide the resources that say, hey, you know, if you feel that, you know, you need that extra help, this is where you need to go. This is, you know, to address these issues, because things may change. Because that is just life, you know. Things change in the drop of a hat.
It is interesting. Mental health is such an important aspect of diagnosis, and it does feel like it's almost an afterthought of the whole process. I think several people have talked today about getting their diagnosis, you know, on a weekend or at night, and you're left alone, and that has happened even in my own experience as well with my daughter. As well, you have family members and children that you're also trying to kind of save face for, make sure that they're okay through this. And some of the mental health aspects really aren't added into the medical plan until we come forward and say, I'm really struggling here, man, I need some help. And so I really think, you know, your story about this is really such an important message. It really, really, truly is. Yeah. What is your experience with that, Josh?
Yeah, definitely the mental health aspect has been super challenging. Also just having to do so much work and figure out what was going on.
Right.
Especially I don't have a medical background at all. I work in music and entertainment. So it's like having to, you know, really do that level of research and understand like my condition and the symptoms and how to go about finding.
You have to almost become a medical expert in
Right.
your own right to find all these
Yeah.
aspects and piece the puzzle together.
Yeah, I wasn't expecting that at all.
Right. And do you feel like after you have a diagnosis that you have a release from that pressure at all of finding a diagnosis, or what happens? Like you're still kind of up in the air.
I'm just grateful that I don't have to deal with the symptoms anymore.
Right.
So, yeah.
That does change it, doesn't it?
Yeah. So I don't really think about it as much.
Yeah, yeah. What areas physically or emotionally do you find most difficult to really open up about? Like we're talking about diagnosis here, and you've shared some other things about, you know, how it's affected you with your family and having to admit, I've got some, you know, emotional impact here that I need help with. But are there things that really aren't, discussed, and things that you're more nervous to share publicly about emotionally? Is there pressure on marriages? Is there pressure on relationships, for example? Is it worrisome to tell your children? Like, are these things that you can really open up about to your clinician?
Well, I guess the struggle with marriage will be probably one of them, because, I mean, there was some struggles there after the diagnosis came along. So that was a struggle to discuss that at first. So definitely that was very challenging, but eventually I did voice those concerns. Obviously, my husband and I have to work through certain things, and, you know, to get to the place where we at right now, we, you know, have to work and, you know, compromise, sacrifice in order to be where we at today. So definitely, yes. As far as sharing with my kids wasn't so difficult, well, at least with my oldest. He's 24. So when I was diagnosed, he was in his early 20s, and he was able to understand what I was dealing with. It was harder with my daughter. At the time, she was 9, so having to explain that to her was a little bit harder. Because obviously bringing it to a 9-year-old in her words, you know, in words that she could understand. As she has gotten older, I've been able to talk to her more about it so she could learn and have a better understanding. But at first, that was difficult. And having to, you know, tell her, well, you know, certain days I'm not going to feel good enough to do certain things. that was difficult for me to do. But now she understands, and now she knows that when mom's not feeling well, you know, I need to rest. I need to just slow down a bit.
Right.
It was never really difficult for me to talk to my son about it, but I mean, when I was hospitalized for almost like a month, it basically ruined my marriage. Like, we sort of separated because of that. There was other issues too, but it was not a good time, and there's like permanent, you know, damage from it.
It is interesting when you're dealing with relationships and also navigating a diagnosis. When my daughter was diagnosed, her father was a recovering alcoholic and drug addict. We had been together many years, and through that diagnosis, the pressure on our relationship became overwhelming, because now I have to be a medical expert inside my home.
Yeah.
I have to navigate all of her specialists. I have to try to identify all of her needs. I have to make medical decisions that Emily spoke really perfectly about, that are really scary. And then you feel so isolated. And then your expectation of, what is my spouse supposed to support? How do I feel they should support me? Is there an expectation? What does that look like? And our relationship fell apart. And now I'm navigating a diagnosis and all these specialists and losing someone that I love. It's really, really hard. So I understand that. How do you recover from this? Now that you have a diagnosis, does that, or not even a diagnosis, but you have a suspected diagnosis, do you feel a little bit of relief knowing that? Does it help this?
Yeah, but because I don't deal with the symptoms as much, I just kind of disassociate and not think about it.
Yeah. Having that symptom that's now not in your face every single day.
Yeah.
You're welcome. Thank you. So being vulnerable and sharing your insights, in my personal experience, has really opened up opportunities to be vocal about the emotional side of things, and it's really helped to share with medical experts and, you know, opportunities like this with other families as well. But it's not easy to do that, to be really vulnerable, and then, you know, you're kind of left.
No, correct.
You're left
It's not.
explaining things. But can you have any advice, or do you have any advice for individuals about the importance of being vulnerable and sharing these things, and why should it matter to a clinician or someone else?
It matters because you want to be heard and you want to be understood. And I think the only way that you will be able to accomplish that is by being able to share what is going on, being honest, showing yourself some grace, as I will say, being kind to yourself, and just, you know, really opening yourself to be able to receive that help, to, you know, in order, you know, to be able to, you know, be understood by your clinicians, whoever it is that's treating you, so they have a better idea what's going on with you. Obviously, keeping things in does not help, doesn't work. You could only deal with it for so long before you break, before you have a breakdown. And no one is an island by themselves. If I've learned anything in this journey, is that you need a team of people, and it's just not only family, friends. And again, I do have that support now. It's a very small number of people, but that's my tribe, you know, but also my team, my medical team. It's just having those people there when you need them, and that's important. And if there's something going on, you need to be vocal about it. You need to speak to them. And sometimes that means that, you know, if you're vulnerable, you got to open up about something that maybe you don't want to, maybe you should, because, you know, that's going to bring help. It's going to bring you relief.
Right. Josh?
Yeah, you have to communicate. I've never had any issues like being vulnerable or communicating, so it's never really been a challenge for me. So I probably talk too much.
Thank you guys so much. It's been so amazing to get to learn more about you guys, and thank you for being up here and being vulnerable. It is really tough.
Yes, it is.
And, you know, asking you to dig deep in this way to share is just really special, actually. So thank you.
Thank you for having me.
I don't know if you've ever heard this sentiment, but I think that being vulnerable is probably one of the greatest acts of kindness because other people can see themselves in you. So thank you for that very, very personal panel. We have one final panel to go. And I'll tell you that the theme that I see mostly today is change, adapt, change, adapt, change, adapt, over again. You can never get comfortable, right? We've heard that a lot in the stories that have been shared today. So we've got a couple of speakers who are going to focus on change. So we have two parents, two moms who are going to talk to us about what it means to transition care from pediatric to adult care. And then we have two adults who are going to give us that perspective from primary care to specialist care, et cetera. So we will have Tara Kearns, who is mom to Trey, join us. Tara is the vice president of the PFIC network. We also have Jennifer Lau, who is mom to Nate and co-founder and president of BEAR. And we have Amber living with PBC, Carol also living with PBC, who is the president of PBCers. So take your spots. Come on up. Thank you.
So good morning, and thank you for such a kind introduction. This has been really incredible to hear all these different perspectives as a mom to two young boys with PFIC, with a PFIC diagnosis. It's really nice to hear from other people across the lifespan about how disease has impacted them. So I feel really honored that we get to kind of wrap this session up with something else that seems like the next transition in the life of a caregiver. My oldest son has been transplanted, and he is now a teenager. So he's 15, and among other challenges of raising teens, we are now being faced with that transition into adult care. So I'm really excited to be able to talk with you guys and talk about something else that I'm really, shifting passions into. So thank you guys for being here. Let's start by first sharing what you felt like has been the biggest moment of transition for you personally, as you or a loved one has had to navigate care for rare liver disease. Do you want to go first?
Okay. First, I'm going to say sitting out here listening to everybody has made me feel very old because you're all talking about jumping on Google and finding this. Google didn't exist when I was diagnosed in '99, so in a way that may be a benefit because I didn't have some of those to jump into. But yeah, I'm definitely the oldest person sitting here. So I was diagnosed in 1999, and I already had cirrhosis at that point. So it was a very different, I didn't go through the early stages, but it was like every time you went and had blood work done, it was like you were holding your breath, waiting for that other shoe to drop. And then you get the results, and it's like, okay, I'm good for another 6 months. But it was transitioning at that point. I mean, I started right with a specialist, and my transition came 25 years later when my liver failed. And so trying to go from a very close relationship with my provider for 25 years to a different health system, a team of people that I didn't know, especially at a point where you're so vulnerable.
Right. So it sounds like that transition into, a referral to a transplant team was really impactful for you.
Yes.
Jen, what about you?
So I think, my son was diagnosed very young, right? I mean, he was 5 weeks old at the time. He was diagnosed with biliary atresia. So I feel like I've been transitioning my whole life since he's been born, because you go from being a new mom to then having your child being diagnosed to a rare liver disease, to then saying you have to go to transplant. So you're transitioning from a new parent to caring for a child who has, a very rare and serious liver disease. And then, so you're kind of thrown into this club you really don't want to be a part of, but it's your club, right? So, and then from there, then you're transitioning into the transplant world and what that can bring as well. And then after transplant, then that's a whole other world too. So I feel like as a parent, you're always transitioning as you're going and going through the journey with your child and helping them and guiding them then as they get older. So I think that those are just some pivotal points that have been in my life so far.
Yeah, well, thank you for sharing that. That really resonates, right? Being part of a club that you didn't ask to be a part of. There are lots of clubs that we want to be in,
right.
But then you get thrown into these clubs like, wait a minute, I didn't ask for this one. And then what about you, Amber?
So I had like two pretty big transitions for me. The first one was just going from having a general PCP to having to suddenly see specialists. I grew up in a family that was very doctor averse, very medicine skeptic. So it was already a really big leap for me to be seeing a PCP regularly and getting myself checked out regularly and looking at my symptoms instead of just living with them. So having to change from that to having a specialist was even bigger and even scarier, and I didn't really have any help from like my family of even knowing how to navigate any of that. And then more recently, we went from, I had health insurance through my job, but then 2 years ago when I became pregnant with my twin daughters, we knew that I was gonna have to stay home. So we had to switch from my insurance to my husband's insurance, which meant we had to switch all of the doctors. So like all of the work that I had done to get really comfortable and really understand, and my doctors understand me and my concerns, and where I came from, all of a sudden we had to switch. And everybody, so it was not just my specialist, I had to switch all my doctors, so that was just a lot all at once.
Right. Well, thanks for saying that, because I think that's a part of sometimes this patient journey that we don't always reflect a lot about, but that shift in insurance or losing insurance or switching from private insurance to public insurance, but those are all things that we have to navigate, not just with providers, but with medication options, things like that. It's really complex, so thanks for bringing that up. That's a significant transition that patients do have to go through. So each of you, and we can start with whoever wants to go first, but did you feel as though you had support through those transitions that you talked about? Being referred to a transplant team, being welcomed to this club, or even having to switch from, that transition in healthcare, right? Did you guys feel like you had support?
Well, I did have family support. I had support from the PBCers organization at that time, but going on what she had to say is that the transplant was in a different hospital system. Okay. So I also had to leave everybody and deal with a whole new hospital system, that they don't connect.
Yeah.
So any information I wanted to go back to my GI doctor, I had to make sure got there because it wasn't there automatically for him, and that was really hard.
Okay, so it sounds like in this transition, you kind of were flying solo.
Right.
You had to
and it was
navigate
a very quick transition. It was a very quick decline, so I wasn't in the best of mental health at the time, and to have to deal with that made it very difficult. Okay. But they were very supportive. It was a good team, and I was very happy to have them there. I just would have liked to have my longtime doctor with me.
Yeah. And what about you?
So I was very supported through I leaned on family, I leaned on friends, I leaned on our team of doctors, in every aspect. So, I feel like my son kind of had an entourage with him the whole time, which was a great feeling. But I will say what is interesting and happens a lot that we have found in our community talking with other families is that once you go to transplant, it kind of seems that support shifts a little bit. So the people that were your friends that were there for you before, or even family members that were there for you before, they can disappear. And that's kind of what happened to us. But we were fortunate enough that, we kind of had a new village to be a part of. So, we connected with other families that their child had transplanted or had that disease or what have you. But I will say the constant, other than immediate family, the constant that was in our life was our transplant team the whole time. So we were very fortunate.
That's great. You were part of a new club?
Yeah, the new club. Yep.
And what about you, Amber? Did you feel supported through these transitions?
I think my family did the best they could. They didn't really know what to do any more than I did, really. So there was a lot of, they gave me space to be able to go and research different doctors, see what I needed to do. So there was support in that way. There was support emotionally. There was support in making sure that someone was watching the kids so I could go and do another appointment, another appointment, another appointment. But when you're switching from a whole team of doctors to a whole another team of doctors, a lot of that had to fall on me because the doctors didn't talk to each other, and so a lot of the scheduling was super wonky. One doctor would say, you have to see this person immediately, and the other doctor would say, I don't have any appointments open for like 3 months,
Wow.
which is, it's difficult for them too. That is not to disparage them, but it was very much I was the point person for it. So most of the support I got was making sure that I had the space to be the point person, which is support, but it's not necessarily the support you would want at the end of the day.
Right, and that's challenging. It's challenging, when you're the scheduler, you're the expert, you're the person that asks all the questions. You're wearing all those hats at once. I'm, grateful that you were given the space to do so, but also understand the weight of that. So Jennifer, when we think about parents ensuring the transition from pediatric to adult care is smooth, what does good look like? Like, what does a good transition? What is a nice, smooth transition? What does that look like from pediatric to adult care?
So obviously, it looks very differently from patient to patient, I'm sure. But in my personal, in my perspective, there's a lot. That is like a huge question to answer. It's a big question. I think first and foremost, like one of the things is communication. Communication and partnership between you and your team. When your child is starting to kind of hit those marks of, okay, now we're going to kind of teach them this. Now we're going to kind of go on to the next step and teach them that. So as you see kind of like that transition path start, communication with the team is first and foremost very important, and making sure that it is a collaborative approach throughout that time. The other thing that for me, I think that's really important is, there are transplant kids, and kids with whether it's liver disease or pre and post transplant, who also have other secondary things with them as well. My son, just for an example, he also has eosinophilic esophagitis, the EOE. So for me, what would be very important for him as he moves over and transitions to adult care is making sure that includes all of the specialties. Right. So, these kids do not just go from, GI to GI or, transplant to transplant, but, some of them see cardiology, some of them see dermatology, so it's really making sure it's a holistic approach when it comes to transition, and making sure that they're set up for success in the adult system with what they need, and to be able to continue the care that they do need to receive, not just in transplant, but in everything else that they have had along the way. And then I think lastly, and I'm probably going to need this, my team to tell me to let go. Right. As a parent. We have been in control of their care for so long, and do not get me wrong, it has been great to see my son kind of take some of these early steps now. Like, he helps me fill his pill box. He takes his own medicine with me kind of, making sure off to the side. And these are like little things right now that are kind of teaching and helping him become that adult person in his care. But I know there's going to come a time where the docs are going to have to be like, there's the door, Mom.
Yeah.
And I have to do that for him, right? I have to do that for him, and it's going to help him understand how important liver health is for him. So I know that's coming down the road.
Yeah, and that's scary.
It is very scary.
How old is your son?
So he is 12. He'll be 13 in December.
Yeah.
So we're getting right there. We're starting that beginning point, and I think what will help me when we're talking about transition of care, I think what will help me as a caregiver is just making sure that it is a collaborative and team effort, because that will help me let go a little bit more.
Right.
So, yeah.
And I like that you say that because, like I shared, my son's 15, and that's where we are right now.
Yeah.
So one of the biggest, I think, fears as parents is that we have been that advocate. We've been that voice. And throughout the process, we're teaching our children to also have a voice. But then what does that look like when we let them go? One of the other things I think about from pediatric to adult is pediatric in some of those senses, it's really fluffy and warm, right? You walk into pediatric centers and there's rainbow things on the floor and sensory sensitive rooms. And the adult world is not like that. So you go from going to a pediatric hospital, and then one day you just graduate into, a gray building. So, it's making sure that that they understand then how to speak for themselves, because now we're going into something that's they're going to be received a little bit differently than they were as children. So I appreciate you speaking on that too, as a parent, being able to let them go.
Yeah, I mean, the kids have had their hands held for so long, so have the parents, right? I mean, we've had our hands held too in a certain way. So,
so thanks for that.
I listened to you both talk about this, and somebody telling you that you're going to let go. Having raised children through that and also grandsons through that age, I think the first one that's going to tell you to let go is going to be that child.
Oh, you are not.
And it's coming very soon.
Yes. So, Carol and Amber, what does your ideal care team look like now? Right? You are both in the adult system. So what does your ideal care team look like now? What do we have to look forward to?
I mean, personally, I would like to have rainbows on the floor. That would be my ideal. So one big thing that does frustrate me when I go into, and when I was transitioning, was walking into a doctor's office, because kind of like Jennifer's talking about, I don't just have PBC. I have a couple other sicknesses, and so we were trying to navigate treating a specific issue. And I go into, it was my gynecologist's office, and she presents this entire plan of action. And I happened to make a small comment about, not taking extra supplements without my GI's permission because I have PBC. And she goes, oh, that means we can't do anything I just told you that we can do. But the note is right on top of on my file that I have a liver disease. And she's like, oh, someone with a liver disease can't do anything I just told you. And I'm like, then what were we just doing for the last 45 minutes? So being able to walk into a team where people have read the material, which some of my doctors have. That is not my experience with everybody. But that has always made the difference between whether or not we have good productive conversations, or whether or not I kind of retreat into the they weren't paying attention to me as a person in general. But also a part of that is realizing that I am the point person. As much as I might not want to be, I would like someone to hold my hand. I would like them to just tell me what to do. I am the point person between all of my different specialists. And so, talking to other PBCers, it has been a lot of putting together all of my own stuff in a central space, so that when that happens, I can bring all of that information to my doctor and have it right there. Here is my biopsy. Here is my test results. Here we are ready to talk about this. So someone who respects that space. And having my family involved in that process as well, of like helping me compile things, helping me remember. My family will remind me, like, these are the 5 things that you said you really needed to talk about today. Here are the test results you were trying to get today. So getting more input and more help from my family to, you know, help with that mental load.
It sounds like being the CEO of your own home, right? What about you, Carol?
I haven't had a real hard time. My perfect goals to what my care would look like now are really what I have. But it's actually another transition that I had to make was that leading up to the final stages and the transplant, you're here, you're there, you have this appointment, you have this scan, all these things going on. You have the transplant, and for a few months, you continue that. But I'm 3 years out now, and I feel like, gee, nobody wants to take a picture. Nobody wants to, you know, oh, we'll see you in a year. And I'm like, where did all that care go?
Right.
I'm on my own now.
Right.
But it feels good to be on your own, but there's just that little bit of you that's like, what am I missing? Nobody's checking. So.
Right. You know, I hear you saying that you go from, it almost feels strange to feel healthy again, right? Post-transplant.
It is. It's a transition to being a healthy person.
Right.
Although I don't have I haven't moved on from PBC. You know, one of the first pieces of advice is people to tell you to live your life, but actually PBC became my life because of my role in the organization. So it really is the focus of my life at this point.
Right, and I feel that sometimes even as a parent post-transplant, right? You go from having a lot of things that you're worrying about and watching. It's hard to turn that off once they become stable or start to live life again differently. It's, you know, are we sure? Are we sure we're okay? Nobody wants blood work.
I don't have any appointments.
It does. It feels a little odd. So while change is inevitable, what defines a sound transition versus transactional handoff?
I would say that it kind of depends on the communication between the two parties that are transitioning you from one to the other. And as long as they're communicating and not just say, okay, here's where you go now, you know, and you can always feel that you can always check back with the other team just a little bit, then you feel more comfortable during that transition, I think.
Kind of creating a bridge.
Yes.
Okay.
I'll have to say, like, from a pediatric perspective, the two systems need to communicate. They need to work together. In my opinion, it's a little bit of a different monster, right? So when we're talking about transition versus transaction, instead of just saying, well, here's your adult center, good luck. There needs to be ample time for not only the pediatric center, but for the adult center to work together and come up with a plan involving the family as well in that discussion. And in my opinion, gradually starting to make that transition become comfortable, not only for the family and for the patient, but also for the pediatric caregiver to make sure that that their patient is going into a center that is going to be still paying attention to what's going on with that specific patient. So
yeah, it sounds like some maybe overlap for a period of time to make sure that it's a smooth transition. Right. Spending time in both at the same time. That's a good suggestion. I like that. Amber?
I think building off of Carol's point in terms of communication, kind of a receptivity. So when you are transitioning from one practice to another practice, or from one like a PCP to a specialist, the feeling that you are not having to start all over again at square one, not having to repeat every single thing from square one when it's in notes. The difference between a doctor going, okay, I've seen all of the stuff that we're dealing with, now where do we go from here? Where do you want to go from here? Versus, well, now we're going to have to run all the exact same tests that you've already done, and eventually 7 months down the road come to the same exact conclusion that your last PCP came to. So kind of a receptivity of when you are transitioning a patient, it is not just, oh, new patient, new person, new client. But this is a whole person who has already done a lot of tests, has already had a lot of conversations, that they're looking to continue with you, not to completely start all over again.
Sounds like respecting the journey that led you to that person and really, wanting to hear from you. I appreciate all of your input and your perspectives. I think, like you said earlier, I think this transition is quite a beast, right, to tackle. And it's nice to be reminded that transition looks different. I think a lot of times when we think about transition, it's easy to think about pediatric to adult care, but there's all other sorts of transitions to really be mindful. And I think while in life change is inevitable, change is always going to happen. We've talked all day about the needing to adapt and adjust, but it's just a nice reminder that transition is it's a part of this process. It's important to respect that there are people and feelings and human and lived experiences behind each of these transitions, and to really be respectful of what those transitions are creating in everybody's journey. So I really appreciate you guys, and I appreciate you guys for taking the time to listen to us, and thank you so much. Thank you.
You got it? Thank you, guys. So this concludes our first Voices Community Summit. I think we'll probably do it again. We'd love to hear your feedback. For those of you online, leave us a comment. Let us know your reaction. We'll keep the conversation going. For folks in the room, you've got pledge cards at your table. If you